All right, hello. This video is from Melissa Gregory, Carrie Godden, and Christina Davis. And the outcome measure we're doing today is the Mini Balance Evaluation Systems Test, also known as the Mini BEST test. So the body function for the ICF is activity. The purpose of this test is it's a clinical balance assessment tool, and it aims to target 4 different balance control systems so that rehab approaches can be designed based on the deficits. And those 4 different balance control systems include anticipatory postural adjustments, reactive postural control, sensory orientation, and dynamic gait. This is a performance measure. It takes approximately 10 to 15 minutes to administer. The equipment that is needed includes a 60 by 60 centimeter box of medium density foam or a balance disc, an incline ramp of 10-degree slope, a standard chair without arms or wheels, a firm chair with arms, a box that is 9 inches in height or approximately 2 shoe boxes, a stopwatch, and a piece of tape on the floor to mark 3 meters from a chair for the tug test. The target population includes varied neurological patients with balance disorders, and the diagnoses that this test has been studied on includes acquired brain injury, geriatrics population, hip fracture, movement disorder, multiple sclerosis, Parkinson's disease, peripheral neuropathy, stroke, TBI, and vestibular disorders.
All right, first we're going to assess the anticipatory postural adjustments. So first I'm going to have you cross your arms across your chest, try not to use your hands, and try not to let your legs lean against the back of the chair whenever you stand. All right, and stand up. Can you please stand shoulder width apart? Can you place your hands on your hips? I'm going to have you rise up on your toes, and I'm going to count to 3 seconds. 1, 2, 3, and come down. Okay. With your hands on your hips, I'm going to have you lift your right leg behind you and try not to let it rest upon the standing leg. Go ahead. 1, 2, 3, 4, 18, 19, 20. All right, this time we're going to be doing the same thing, except I'm going to have you lift your left leg. 1, 2, 3, 4, 19, 20. For the anticipatory postural assessment, for sit to stand, our patient scored normal, which was a 2. She comes to stand without use of hands and stabilized independently. For item number 2, rise to toes, our patient also scored normal, which is a 2. Stable for 3 seconds with maximum height. And for the third item, stand on one leg. Our patient scored normal on both sides for both trials, which was 20 seconds. Also scored a 2.
Test the reactive postural control. I need you to stand with your feet shoulder width apart, your arms at your side. I need you to lean into my hands, past your limits of stability. When I let go, do whatever is necessary to keep standing. Okay. Now we're going to test your limits of the backward stability. So I need you to lean backwards into my hands. When I let go, do whatever is necessary to keep yourself standing up. Next, we're going to test the lateral limits of stability. So I need you to stand with your feet together this time, hands at your side. Lean towards your right side into my hands. Past your limits of stability. When I let go, do whatever is necessary to stay standing. Now we're going to test the limits of your lateral stability on the left side. So once again, lean towards your left into my hands. When I let go, do whatever is necessary to stay standing. Our patient scored normal for all of the reactive postural control tests, forwards, backwards, and lateral. She took 1 step forwards, 1 step backwards, and a crossover step on both the left and right sides laterally to score a score of 2, and which was normal, like I said.
So now we're going to assess sensory orientation. So please go ahead and stand with your feet together. Hands on your hips. Look straight ahead and remain as stable as possible until I say stop. 1, 2, 3, 28, 29, 30. Please place your hands on your hips. Remain as stable as possible until I say stop. I'll start counting as soon as you close your eyes. 1, 2, 3. So this is approximately a 10-degree slope incline. So go ahead and place your toes at the top of the incline, your feet shoulder width apart, hands by your side. Remain as stable as possible until I say stop. I'll start counting once you close your eyes. 1, 2, 3, 28, 29, 30. For the sensory orientation items for number 7, with the feet together, eyes open on a firm surface, the patient scored normal, which is a 2 because she was able to hold the position for 30 seconds. For item number 8, which is feet together, eyes closed, foam surface, the patient scored a 1, which is moderate because she was unable to hold it for 30 seconds, so it was less than 30 seconds. And for item number 9, which is on an incline, eyes closed, the patient scored a 2, which is normal because she was able to stand independently for 30 seconds aligned with gravity. Okay, when I say go, start walking at your normal pace. When I say fast, walk as fast as you can. When I say slow, walk as slow as you can. All right, go ahead and begin. Fast and slow. When I say go, you'll walk at your normal pace. When I say look right, turn your head to the right. And when I say left, turn your head to the left. All right, go ahead and begin. And look right. And look forward. And left.
All right, when I say go, I need you to walk at your normal speed. Listen for me to say stop. When I say stop, I need you to turn around in the opposite direction and stop. When you do stop, your feet should be as close together as they can. Ready? Go. Stop. Next, we're going to be stepping over some obstacles. When I say go, you're going to walk at your normal pace. When you get to the shoe boxes in the middle, you need to step over them and not around them and continue walking. Okay? Ready? Go.
All right, when I say go, I'm gonna have you stand up from the chair, walk at your normal pace to the tape, turn around, and sit back in the chair. Go. All right, I'm gonna have you count backwards by 3, starting at 20. I'm gonna have you rise up from the chair, walk to the tape, turn around, and sit back in the chair while counting the entire time. Go.
20, 17, 14, 11, 8.
All right, for the dynamic gait assessment, for item number 10, the change in gait speed. For item number 11, the walk with head turns horizontal. Item number 12, walk with pivot turns. And item number 13, stepping over obstacles. The patient scored a 2, which is normal for all of those items. For item number 14, the timed up and go dual task, the patient scored 7.9 seconds for the normal trial, and then for the dual task, the patient scored 9.13 seconds. And we gave the participant 2, which is normal, because there was no noticeable change in sitting, standing, or walking while backward counting when compared to tug without dual task. The score for this test was a 27 out of 28, which is considered normal. And to give some statistics from studies, a cutoff score of 16 had adequate ability to predict 6-month prospective fallers. The mini best test is found to have excellent concurrent validity with the Berg balance scale, and no ceiling effect has been evident.